Dr. Lena Green comes with a mass of expertise in the field. And she's associate professor and project manager at Hope Center. She's an executive director there. And she's also the associate professor and project manager of population health science and policy at the Icahn School of Medicine at Mount Sinai. She's also a clinical professor at NYU and Columbia University Schools of Social Work. And she is also someone that has had a lot of experience as a clinician, integrating faith-based and mental health together into the work that she has been doing. She has received numerous awards and accolades. She was also part of the 2023 Joseph R. Biden Presidential Service and Lifetime Achievement Award winners. And so without further ado, I would like to introduce you, and I ask that you give Dr. Lena Green a warm welcome as she comes forward. Thank you.
Thank you, Dr. Frazier, for that warm welcome. I am connected to a faith-based institution called First Corinthian Baptist Church. And so I'm incredibly excited to be here with you all today. And I like a little bit more feedback. So I'm going to say good morning again with all my enthusiasm and excitement. I traveled all the way from Harlem to be with you all this morning. So good morning again. Good morning. All right. So we're going to spend our time talking a little bit about our program and what we do at the Hope Center in partnership with Mount Sinai Hospital. We're going to discuss the importance of building partnerships and community building. I heard Dr. Frazier mention that earlier. And then we're going to talk about some strategies for engaging and retaining people in mental health and wellness programming. I like to think that we do that pretty well. And I'm someone who is very outside of the box in terms of my thinking, in terms of my practice, in terms of what I encourage my staff to do, as well as the faith leaders that we work with. So we're going to do a lot of learning today, but I also want us to get a little bit cozy, okay? So we're going to be talking to each other as well. So I'd like to start this off because I'm going to be talking to you about our teams and our program Thrive today as well, about one of the examples in how we engage community and how we retain and maintain our contact, specifically with one of our population-based services, which is focusing on decreasing the rate of suicide, specifically in Black and Latino teens. Okay, but that's our kids. This is on our Hope Center Sunday, which we essentially get to take over the entire church service, which is like unheard of. So it's really exciting, and we do this once a year. And our children are talking about the impact of mental health and providing some statistics. And this is actually right on the pulpit at the church. So I always like to start with that because it's a good representation of who we are and what we do. All right, so that's a little bit about me. You heard about me, so I won't bore you with all that information. All right, so let's start off being a little conversational with one another. And so my first question to you all, I'd like you to answer the question, what is community and how do you build community? All right, so we're gonna give ourselves 2 minutes to do that. I'm gonna ask you like we do in church, turn to your neighbor. Okay, and so let's do that for 2 minutes and engage in that conversation. So what is a community and how do you specifically build community? All right. All right. So I am so sorry to cut off such good conversations, but I'm going to ask us to come on back together. That was a quick 2.5 minutes of discussion, so thank you all so much. Is anyone feeling courageous enough to share either what you shared personally or what your group shared about A, what is a community, and then 2, how do you build community? Any takers? All right. Okay, yes. Okay.
So we were discussing that, talking to each other about not very personal things, but one person mentioned, how's your kids or how's your grandkids? How are you feeling today? I mentioned like we share food in the morning, or who has bread, do you have some jelly, those things like that. Checking in how you feeling today, you know, what's going on.
Okay.
Those things help make our
All right. So we've got breaking bread together or checking in on one another, doing that through conversation. That's how we build community. One more? Yes? Yes? Uh-huh. Shared experiences. Uh-huh.
Have those shared experiences. But also, I don't know, maybe this is just on my heart, but the way I'm feeling now are that community is somebody or something that shows up and that is committed to do the work.
Okay.
I'm going to share my story.
Okay.
Because you gave me a mic.
We
But I
welcome
was
it.
saying, like, now, you know, I attempt to create partnerships with people in the community or organizations. And people will do the paper. They'll sign the paper. But it's like, will they do the work? Will they commit to what we're trying to do as a community? So community, for me, shows up. A community is committed to the cause. In a community, we share those, like, experiences, but we also want to learn, right?
Yeah.
So that's it.
All right. Thank you. And we'll take one more if someone is like, has a burning desire to share. Anybody else? Okay.
Hello, my name's Jerome Archer. How do you build your community? First of all, for me, it's more of being consistent, showing up every day, having the right information. First, figuring out your target,
Okay.
where you need to, promote what you're bringing to the community and how to express it and get people to join in. So just being consistent, having the right information that I received through Arthur Ashe for 21 years now. So that helps me give back to my community.
All right. Thank you. I appreciate all of those definitions. Please give yourselves a round of applause. And so that's an important question that I ask you all because I believe that our mental health and well-being actually takes place in community, right? And so while I have all these, degrees and letters behind my name and blah, 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 it's really about connecting with other people, right? We don't get hurt. We don't, decompensate in spaces in isolation, which also means that we don't heal in isolation, that we need one another in order to be well and in order to be mentally healthy, right? Whether it's connecting, whether it's sharing a resource or providing education, we can't do it alone. And so oftentimes when I'm asking folks about, what's going on with them, many people say isolation or I feel alone, right? And what surprised me, actually, I learned this really during the pandemic, was I thought it was mostly going to be seniors, but a lot of our young adults and a lot of our teenagers are saying that they feel alone. And that shocked me a little bit, right? Because, if you are senior, you have more mobility challenges sometimes. I know a lot of times our seniors working with them, they were like, they don't want to come out of the home. They're not going to the spaces where they once were for various reasons. But when I heard it from the young adults, right, it took me some time to really understand a little bit more about, well, what else is going on for them, right? And so these are some of the definitions of community and the places that we find community, right? So it could be a place, it could be a population, it could be a political system, a social organization, right? A cultural system, a social unit, a unified body of individuals. Communities can be defined by shared place such as neighborhood, town, or country, or by a shared set of characteristics such as our values, culture, religion, or identity. It's also a feeling of fellowship with others as a result of sharing, and some of you said this already, common attitudes, interests, and goals. And so that is really how we build community, right? And that, to me, is really how we came to be in terms of our programming at the Hope Center. So it helps us, think about distinguishing ourselves as people, our stories, they have meanings, and they're a really important part of who we are as our identity, right? They carry deep personal, cultural, familial, and historical connections to who we are, right? And it's also the story specifically around Black mental health when I'm thinking about it, right? Specifically because I'm providing a service that is connected to a Black church which the story behind Black mental health comes with a lot of challenges, right? Historical adversity, which includes being enslaved, sharecropping, race-based exclusion from healthcare systems, educational systems, economic resources, which also translates to disparities experienced by particular communities, right? Socioeconomic status is also linked to mental health outcomes, including poverty, homelessness, and incarceration. And it leaves us at higher risk for poor mental health, right? And so what ends up happening is that specifically when folks are excluded, they end up being sicker, specifically Black people, sicker and sicker longer, right? So it takes a longer time to recover, right? And some of that is based on mistrust of the systems that we have engaged in, right? We know that racism continues to have an impact on mental health, and we know that negative stereotypes continue to exist, which also lead to adverse outcomes, right? So those challenges may lead to, help-seeking behavior, right? So if you're afraid to seek help, then that means you really may not be connected to the services that you need in order to be well or get well, right? And then we know that negative treatment for certain populations has led to distrust of authorities, right? So in community, we also learned our stories and oral traditions around mental health, right? We know that stigma has been passed down, right? So for many of us, it has been, that's, Uncle Charlie. He's just not right in the head, right? Or for many of us who grew up connected to faith-based institutions, it has been if you're feeling depressed or you're feeling anxious. Can anyone tell me where they would traditionally tell you to take it? To the Lord in prayer. Take it to the altar, right? And so that means that for many of us, if we are raised with strong faith, many of us end up feeling like we haven't prayed the right prayer. We haven't sought the Lord long enough and hard enough for this, right? And so my tagline is, especially with working with faith-based communities, it's prayer and therapy, right? We need both, right? If you can go to the doctor because your leg is hurting or your heart's not feeling so great, right? Or your elbow is not bending the way it should, then if you're not feeling well, your mind is not feeling solid, if you're not feeling right, then that too warrants us going to the doctors or going to the folks that can help us get well and feel better, right? And so that leads us, well, who can we trust, right? And then where do we go for trusted places and spaces, right? And so that's where really the house of worship has really come into play. So we have worked with clergy and faith leaders as frontline workers. We're leading and learning together, right? I'm actually working on an initiative right now with the American Medical Association called Release the Pressure. And we're focusing on heart health, right? Because 80% of Black Americans have some sort of heart health condition. And 50% of Black women over the age of 20, 50% over the age of 20 have a heart health issue, right? And so those are pretty shocking numbers, right? But it means that we've got a lot of work to do, and we've got to think about ideal places to reach people because the information is not getting out there. And so we have to be creative about going into the places and the spaces where folks can feel connected, where they feel like they can be trusted, and we can get the word out. Right? So that's us on Hope Center Sunday. So that's our choir, and we have the big Hope in the back. And so the Hope Center started really through our pastor, Pastor Mike Walren, who was really transparent about his own mental health issues from the pulpit. He has an autoimmune disease that he found out he was suffering with pretty early on, like around 7 or 8 years old. And so he's had chronic health conditions pretty much his whole life. He was pretty transparent about his own battles as it relates to mental health and his own wellness. I think, if I'm not mistaken, the doctors told his parents that he wouldn't live past the age of like 27, right? He's over 50 now, yay. But those are the things that you live with, right? When you're trying to think about, the things that impact your life, right? You get a diagnosis early on, and so maybe you feel like you don't have a lot to live for. So he's been pretty transparent about those challenges. And so he was able to have open discussions about therapy from the pulpit. And so you might think, oh, well, that's not a big deal. But I'm gonna ask you all, how many of you have ever been in a faith-based setting where you've heard anything around mental health from the faith leader? 1, 2, 3. Okay, 5. Right? But it's not often. And so if we think about who is leading in spaces, right, those messages carry a lot of weight. And so if our leaders can say, hey, I'm struggling, I need support with my mental health, then maybe that translates well for someone else, right? So we started with one clinician on site at the House of Worship, and it was available to all of the members of the congregation. And we learned that quickly there was a huge need for services. But people were also a little skittish about going into the church and telling the security guard, I'm here to see the therapist, right? And so we had to think about, well, maybe we should think about confidentiality. We should think about a separate space. And so in 2016, the Hope Center was born in December 15th. So we've got a birthday coming up. Yay, us. We'll be 8 years old. Yes, thank you. And so I've been the executive director there for 4 years. I've actually been working in ministry at the church for the past 18 and a half, working with youth and working with young adults. And then during the pandemic, my pastor called and said, I have a question for you. And I was like, what is it? He's like, will you please come and run the mental health center? And I was like, I need to pray about that, right? Because I was working for city government. I had a good city government job that I worked for 20 years. And I was like, ooh, my pension. I don't know about this, right? That was real for me. But I ultimately said yes because it was an opportunity for me to transform what we were doing in our community. And I had a lot of ideas because working in city government, it was really a public health issue, right? And so I've been working essentially as a public health clinician for 20 plus years. And I thought, well, I could take all that I've learned and apply that to the community and see that if we can make some radical change here. So our mission is to provide quality therapeutic services to the Harlem community and beyond, to directly impact mental health needs and promote health and wellness. Our vision really overall is to empower, and support our community in the process of creating and sustaining lifelong wellness. So we'll get into a little bit more of our demographics later. And so here are our services. So we provide, it's a short-term treatment model, but we provide 12 sessions. And our therapists, which you'll see in a few minutes, provide everything from IPT to CBT to somatic therapy. We provide a host of groups, which you'll hear a little bit more about later, our wellness initiatives. We also have conferences, and we call the folks that we provide services to innovators. We actually don't call them patients or clients, and I have a slide for that. And then if they are in need of longer treatment, we refer them elsewhere. And then we also have a psychiatry rotation in partnership with Mount Sinai Hospital, where we're able to also provide medication management. And then these are some of the things that we provide online virtually, right? So a little bit about staff diversity, which is incredibly important, because we're working predominantly in a community of color. And so we have, largely our staff is made up of clinical social workers. We have psychiatrists, we have a clinical psychologist, we have ministers, we have deacons, we have mental health coaches, we have a ton of interns that work with us, specifically from various social work schools from around the city. The majority of our students come from both NYU and Columbia. And then we also have public health students who join us from CUNY School of Public Health, which is actually located on 125th Street in Harlem. So we have a strong partnership with them as well. And so I just wanted to touch on really quickly the role of our faith leaders, right? Because people might be like, well, what would they be doing? So oftentimes people come in and they're looking for prayer requests, right, from the faith leaders, whether that's our deacons or sometimes our trustees or our ministers and our pastors. But what we've done is train our faith leaders in mental health first aid. So they've been trained. They've also been trained by me to, recognize signs and symptoms of depression so that when people are coming in for prayer requests, right, and this is a very real thing, and they call and they say, I no longer want to be on this earth and I've been thinking about suicide and I just want you to pray for me. Or I am calling for prayer because I've been in a domestic violence relationship for the past 15 years and I'm not sure know what to do with myself or my 2 young children. Or I've been struggling with alcohol and I just need some prayer. And that's great, because they're gonna get the prayer. But they also need to know what to do with that information after they pray. So they are clear about praying with folks and then giving a warm handoff over to the Hope Center. So they've been given information about how to talk about mental health. They've been trained in that. Many of them also have mental health coaching certificates. We are a part of something called Choose Healthy Life, which is a faith-based initiative with our faith leaders as health navigators. So they get a ton of training and a ton of opportunities for them to engage in health and wellness and specifically work with us. And then we also engage in, various other ways that we touch the community. And I just put that up there, our Breakfast Before Books program. So we feed the community every morning, 5 days a week, and we provide breakfast Monday through Friday to anyone who needs it. Specifically, it's targeted toward children, but anyone who needs it in the morning. And that's also a way to provide information to the community. Okay. So we know that these are the factors impacting mental health, right? So cultural and societal narratives. We know that our genetics, stigma, we know that isolation, which you talked about earlier, early sexual debuts, family dysfunction, food insecurity, social media, of course, trauma, and housing insecurity. And that, I dare say, is a short list of things, right? But here's our team. And I'm particularly proud of our team because it's important to me that we reflect the community that we are actually serving, right? And so we have a lot of diversity here. And as you can see, the bottom row makes up the majority of our clinical students. They're all second-year students, so we only take second-year advanced standing students from various universities, and occasionally we may take a first-year student depending on whether or not they have some background in mental health and wellness in some way, shape, or form. But collectively, our staff speaks Korean, Chinese, Spanish, and Hindu. Okay. And this is our impact. This is who we're serving. So we have from ages 12 to 93. 30% of our folks identify as LGBTQ+. We have an increase, which I'm very proud of, in serving our seniors, and then also specifically serving our teens. So our model at the Hope Center is really to deliver culturally sensitive care in a trusted setting, right? And what I like to say is that, over the past 8 years, we've been able to develop some good street cred, right? So yes, people get information about the Hope Center, right? But the best referral to me is word of mouth, right? Because that means that someone had an excellent experience and they're willing to tell somebody about it, right? Because if you had a terrible experience, guess what else you're gonna do? Tell somebody about it. Now, right, we're not on Yelp, so you can't go and, give us a bad review per se, but you can certainly start sharing that information, and communities can be really large or communities can be really small, right? And so it's important to us and important to me to ensure that folks are getting a really excellent experience when they enter the door, specifically because we work with a population that has been historically mistreated. And so I want them to know that as soon as they walk through the door, from that first phone call or that first email interaction, that they are treated with care, with kindness, with love, and with respect. We also want to deliver evidence-based treatment, right? So all of our services are free, and all of our therapists are very highly trained. Specifically, we have a partnership with Columbia University's Center for Complicated Grief. And so many folks don't know this, but there is, during COVID, many of you know, during COVID, communities of color were hit pretty hard. And a lot of folks were still dealing with severe symptoms around grief post-COVID. And there is a diagnosis called prolonged grief disorder, which means that you've been struggling to recover from grief beyond 1 year. And so the Center for Complicated Grief provides training, and so I'm very proud to say that our entire staff is trained and certified in complicated grief services, and we also provide groups and individual services around that. We work very heavily from a strengths-based approach. We want to make sure that we are culturally inclusive, and we want to make sure that we are thinking about how stigma impacts our community, our role, our language. So we're really sensitive to that. And then we have a lot of flexibility in our service delivery. So we are open Monday through Saturday. We have evening hours. We also offer virtual services in addition to being able to provide services in person. Right? And I would say, post-COVID, when sort of the anxiety settled down, that those requests for services in person, have increased dramatically. Just want to check how I'm doing on time here. Okay. And so this is our faith-based model of community engagement, right? So there's a mantra that says, nothing for us without us, right? Nothing for us without us. So that means that we are, forming strong partnerships in the community. We are assessing the community needs. So every so often, probably every couple of months, we send out a survey to everyone who is connected to us on our newsletter or folks that we just engage in the street, because I'm very personable and I like to hear, people's ideas. We identify leaders who will support the cause, right? Because if folks can be champions for mental health and champions for the services that we are providing, they're gonna be good spokespersons for us, right? They're gonna be enthusiastic, they're gonna be engaging, they're gonna be able to touch the community and get folks in the door. We want to take the time to set the context, so we want to understand, well, what's been happening here? What's happening in this community? We don't want to go in blindly. And then we want to honor the community's culture, right? So that means that we have to ask the questions. This is something that we'd like to do. Does this make sense? Do you think this would actually work? Do you think people would come? Right? Those are the kinds of things that we're talking about. Right? Because a lot of times, folks have a lot of great ideas, and they're like, hey, we're going to do this thing, and then no one shows up, and they're like, well, what happened? Well, it's because you probably didn't take time to set the context or to understand, the importance of the things that are important to a particular community, right? And then we want to think about promoting culturally inclusive mental health services that are desperately needed in communities of color, right? So we've developed and tested strategies that significantly increase the participation of communities of color in mental health programming. So again, going back to some of the things that we talked about, flexibility in our programming, using marketing materials that are racially concordant with the target population. And I'll just give you a quick example of that. We wanted to work with a very well-known national organization, and they said, we're gonna send you all of our materials that are gonna be great for promotion and getting out in the community. And I just busted out laughing, and the person is like, what's so funny? I said, what's so funny is that there's nobody on any of these materials that look like me. That's what's funny. And so if you think you're gonna come to Harlem and you want me to promote this program, but none of the folks even have a hint of melanin, I don't think that that's gonna work here, right? And they're like, well, what should we do? And I said, well, we can certainly help you with that, right? But it's those kinds of things, right? Going into communities and providing a service that you think is great, that's not reflective of anybody that you're trying to provide the services to. Right? So that's what we're talking about when we're saying culturally inclusive, culturally sensitive, taking time to set the context, right? What else can I share with you? I talked about the credible messengers, and then thinking about framing programming as an issue of social justice, right? What do we believe that our community members have a right to? Right? Our right to dignity, to respect, to access to care. And so all of our services are free because we want to make sure that we're eliminating the things that get in the way of people actually accessing the services. And so we do that with our partnerships. And I talked a little bit about, where we partner and who we partner with. But we are intentional about recruiting clinicians of color, clinicians who are interested in community-based care. That's actually an area of specialization. Clinicians who are interested in integrating faith and spirituality in mental health. I've been a professor for a very long time, and although we work with many folks from around the globe, spirituality and mental health is not really something that is actually taught in academia. And so we're helping to provide new language and give a new model of what that could look like, right? Because if we're scared to touch the conversation, doesn't mean you have to be a person of faith in any way, shape, or form, but it means that you need to be able to engage people in the conversation about the things that are important to them. And so if someone tells you that they go to the mosque or they go to the temple 3 or 4 days a week, but you're afraid to think about that as a strength or a place where they can be socially connected, then we're not thinking about the core of who the person is, okay? All right, these are just more fun pictures of what we're doing. So here's a little bit about, the kinds of services that we provide. So every year we do the month of hope. April is actually the month of hope. And so we go, like, our programming is like on steroids, and we like take over the city for like a whole entire month, and it's really fun. But we do something called the Power of Our Stories every year, where we focus on a different population. This year we focused on aging and mental health, and so we did a documentary for our seniors, and hearing our stories from our seniors. We have services focused on the LGBTQ plus population. This is our chair and yoga specifically for seniors. And then we do things called healing conversations, where we invite experts in to talk a little bit about a topic that is important. And so here are our population-based services. And so I'm throwing up this quote from your founder, our founder for today. And that is really starting where you are and using what you have and doing what you can. During the pandemic, we received a lot of calls from parents and teachers to say, I need to be able to provide services to my teens. And I would give them a referral, and they would come back to me in 2 or 3 days to say, the waiting list for services for my teenager who is currently suicidal is 1.5 years. What am I supposed to do with that? And I didn't have an answer, because at the time we were not serving teenagers. I'm like, we don't do that here. We serve folks who are 18 years and older, and so I can give you some more resources to figure something out in the community. And they kept coming back, and they kept saying, we don't have any place to send our kids. And so I said, okay, what do we have, what can we do, and how can we be creative? And so in the interest of time, this is a little bit about, the story that I'm telling you right now with regard to our our teens. But it's important to note that the teen suicide crisis, specifically among Black youth, as of 2018 became the second leading cause of death for kids between the ages of 10 and 14 and adolescents between 15 and 19, and that has not changed. That has not changed. And so when parents are calling you because they are fearful of whether or not their child will wake up the next morning, I figured we have to do something, and we started with what we had. And so we had a conversation in 2021, SOS, right, saving our sons, and what could we do about it? I then petitioned Nike for almost a year to say, would you be able to provide some funding for us to be able to support our teens? And they said yes, and they funded us for 2 years. I don't know if we have enough time or if my video will work, but I'd like to share this with you.
My name is Kennedy.
My name is Jessie, and we thrive.
My name is Ziggy, and I thrive.
I'm Casey.
I'm Kylie,
and we thrive.
My name is Josiah, and I thrive.
Thrive shirt on.
Thrive program means to me that you have like other people that goes through the same thing as you, but you don't say anything, but we could come together as a group so we all could talk about it.
The Thrive program is a program that helps young people and teenagers with mental health. It serves as a way to have a stress-free life. They tell you how to function with other people. They tell you how to have a better social life. So I think that's really good.
The Thrive program means to have fun, to respect, love, and accept each other. I've had a great time so far. I've made new friends. I've made new counselors and staff that care about all of us. And I made new friendships.
The Thrive program to me means to try to be open-minded, not all the time, but most of the time. Try new experiences, and I got to meet new people. I've made a lot of friends, and I really like the counselors.
I think mental health is important for black and brown teens like myself because I feel like as black people and as a teen, a black boy, it's harder for me to do certain things that other people can do. And I feel like I need to have that mindset to know that I have to be better because I need to show other people who are either younger than me or just know less than I do that the way we have to think and move as a black and brown teen.
Like recently, a lot of kids have really died lately, and they were mainly African Americans. And some of the kids were dying because of mental health or gun violence. So with mental health, people are dying from mental health because they didn't have a person around to talk to. And when they don't have somebody to talk to, they just think about dying because that's the only thing that comes to their head. That's why I'm thankful for my mom for putting me in this program so I could talk to people about my feelings. But yeah, I have a wonderful mom, a wonderful dad, a grandparents, a wonderful family system to talk to. But I felt like Thrive was just an extra booster for me to let go of my feelings.
Somebody my age, like just teens in general, should join Thrive because it teaches them a lot about Black history. It's a way for them to like communicate with somebody, even if they're like, they don't want to tell someone or something like that, they could like vent to Thrive.
I feel like they should join Thrive mainly because, first off, I wasn't really worried about mental health before this. And then after I joined Thrive, I started taking care of my mental health a lot more because they're helping me see that mental health and physical health, they can both take a toll on you no matter what. So I'd say you should join it because it does help you kind of take a load of stress off your shoulders, stops you from having so many burdens. Now, I can't say that it's gonna help everyone, but it helps me, so it might help you too.
We are Thrive!
Yay.
And cut. I have to cut the video because of that.
We started with what we had and continued to move forward. And since that time, we've had 3 cohorts of 25 teens. We have monthly sessions, weekly sessions when we're able to do so. We engage our teens in community service, as well as a host of mental health resources and services when they come to us. And then we incorporate teen voice and choice, so we give them an opportunity to tell us what works well for them. And then we do our best to create that environment. So that's a little bit about some of the things that we do with our kids. And so I wanted to talk a little bit about stigma and share with you all, the things that we do intentionally to combat that. And one is that we don't use the word patient or client. We use the word innovator. And what is an innovator? It is someone who makes healing a lifestyle. It's someone who is courageously engaging in their pain points of their current narrative to transform their wounds into wellness. We do our best to not use stigmatizing language, including when we're providing, daily services, right? And so even when we say things like, traditionally, of course, this is a hospital, so traditionally we say things like treatment plan, right? Well, we've changed those words to things like wellness journey, right? To ensure that our language is a little bit more approachable and friendly. And then we wear our wellness. We wear what we believe. So we believe that folks are worthy. We believe that they can be their authentic selves. We believe that they are blessed. We believe that, healing is a lifestyle, right? And so these are the things that we do. And so that stuff is for sale as well. It's one of the ways in which we fundraise. And so, just to sort of leave you all with a couple of things about this journey and the way in which the mental health program has come to develop over time, is that I want you all to think about, when you're working with folks, that houses of worship are ideally suited to promote health and wellness. Right. And so if you haven't been able to engage a house of worship, I want you to be thinking about that, because that is where you can find a lot of people, and especially the people in the community that we're trying to serve. That community-partnered engagement helps to foster and expand academic partnerships, right? And so we are intentional about who we engage, both academically, but also spiritually, but also with, as it relates to research. And then we talked a little bit about this earlier with regard to, community-based participatory research, right? And so including the voices of the people that we are trying to serve. And so here's another quote from Arthur Ashe. All right, true heroism is remarkably sober, very undramatic. It is not the urge to surpass all others at whatever cost, but the urge to serve others at whatever cost. Right? And so if you have a commitment to health equity, if you have a commitment to transforming your community and with the gifts and the tools and the resources that you have, that it doesn't have to always be this grand thing. It is the things that we do on a daily basis that make who we are and what we're trying to do better in this world. And so here are a few of I am statements that I'm going to ask you to join me in saying out loud, which is what we do with our folks as well. And so if you can, on the count of 3, if you can just say those out loud with me and declare those things out loud to the universe, I would much appreciate it. So 1, 2, and 3. I am worthy, I am unstoppable, and I am the embodiment of infinite possibilities. So here's my favorite quote by Frederick Douglass, which really helps to motivate all the things that I do in this world, and that is that it is easier to build strong children than it is to fix broken men. So thank you so much for your time. This is the information for the Hope Center, and I hope I shared some good information with you all and you learned something new. Thank you.
Okay, thank you. So thank you so much, Dr. Green. I have time for 1 or 2 questions. So if there's a burning question that somebody would like to ask, Dr. Green, before you leave. Could somebody please share a mic for me, please? Thank you.
Speak louder. I
No,
just
no,
wanted to
just
ask if
because
she also goes into other health faith-based homes and also could this be shared as well?
Yes, yes, and yes. So when other faith-based institutions ask, how is it that you're doing this, we're happy to come in and talk to them about how we do it, about the financing that it takes to be able to run a program like this. And we're currently actually working with Jamani Williams' office to participate in a clergy roundtable in January. Because we're trying to get the word out to other faith leaders across the city about how to engage with mental health services. Now, it may not be, on the same level as this, but we want to make sure that we're sharing some of the knowledge and the resources that we've been able to acquire over the years to at least help them get started and at least point their congregations in the right direction. So thank you for the question. Okay, well, I don't create the list, but I can certainly get your name on the list. I'm working with the person who is in charge of that in our public advocate's office, and so I'm happy to share that information. Absolutely. Yes. Yes, ma'am. If we are invited, absolutely. So both myself and my colleague, Dr. Hankerson, we call ourselves the dynamic duo, so we love a good road show. So we're happy to come out if we're invited. Yes. Okay. Sorry, 1, 2, and then 3. Oh, got it. Go ahead, Martha. Oh, the Thrive program. Yeah, so with our grant from Nike, we were able to provide 10 weekly sessions that focused on social emotional learning. We did a lot of work around mental health. We did a lot of work around suicide prevention. We go out into the community. They do community service. We take them, bowling. It's sort of a combination of things. And so it's myself, it's another mental health clinician, it's someone who has a background in education, and then it's also our mental health coaches. And so we have around 25 students. Right now we're between 18 and 20 for this last cohort. And we just try to make sure that we are available to them during that 10 to 12 week session. And then when we're not doing the weekly programming, we do monthly programming. They also get a stipend, so they get a gift card for $25. They get an Amazon gift card for $25 every time they show up. And our program, when we are doing it weekly or monthly, is from 4 to 6 p.m. We also feed them because we know that many of our students are food insecure. So they're able to come and get a hot meal, work with mental health clinicians, get some activities, do some learning, and we talk about everything from, the shootings that happen in Buffalo or Albany to, what's happening in the news, and giving them tools and resources to be, emotionally, psychologically resilient. Yeah. And we did create a curriculum, so we have that as well. Last question. Oh, 2. Go for it. Thank you.
Phenomenal. I think everyone heard me, right? I just wanted to commend her for the great work that she's doing, and I thought it was phenomenal. I have 10-year-old twins and twin girls, and they go through a lot emotionally, and they've gone through a lot, right? And as you even speak about the statistics of suicide, my heart just cringed when I heard it. So my question is in regard to the Thrive program, how early or how young do you accept children? Because I heard 13, I heard 18, and I think it would be great. I don't know if you accept children as young as 10, or I'm not sure, but that was my question. That's it.
Yeah, thank you. So we serve 12 to 18 years of age, and so that's sort of the cutoff time. And so we have that program, and then we have another program, and sometimes we take middle schoolers. So we work with another program called the Josephine Herrick Project, which focuses on photography. And so we actually have that going on right now. We've been doing that. It's a 10-week program where they come and learn photography skills, and they're able to tell their story from their lens. And then at the end of that 10 to 12-week session, we do a culminating exhibit. So that's something that they might be able to participate in. Again, all of our services in Harlem, so it's a little far from Brooklyn. Oh, you're in the Bronx. Okay, great. So as long as they can get there, we do make exceptions specifically for the photography program. For the Thrive program, they have to be between the ages of 12 and 18. So. Yep.
Yes, congratulations. I really like the
Thank you.
presentation. My daughter goes to the same church.
Oh.
Ida Brown, you probably know Ida. And I've been to the church a few times.
I've seen you before.
Yeah, it's great, great. 2 things I want to say. One, I think that the culture that Reverend Mike creating a new environment where young people, I've seen a lot of young people have an issue with it, with sexual orientation or feeling stuff, because it's an open environment that I think provide that first level of trust, right? And I raise that question because I think the issue about linking faith and spirituality, and people assume that because something is religious, is spiritual, that it goes in the direction of helping the kids, sometimes it produces the total opposite, right? So I think in that area, I think it would be very interesting how much the initiative that you all are taking start educating people that beside of whatever is your religious denomination, whatever your biblical messaging, you have to pay attention to the issues of mental health as something separate. I do, like the Latino churches, I'm from Latin America originally, and a lot of the traditional church, right, do not provide that. The kids opposite. The kids end up very conservative, feel rejected, hide from addressing some of the issue of sexual orientation and other factors. So I'm just thinking that if this kind of work can become where you have a more dialogue with a diverse, different religious sectors understanding mental health and the purpose of addressing this kind of social issues, I think it would be great in a city that's complex as New York, right, with the diversity and the different complex religious practices.
Absolutely. Thank you for that. And yet, you're right? Many houses of worship, regardless of the denomination, are not accepting of a lot of things. And so I think we do well because we are a very affirming space. And we say, regardless of, what is it that you believe or practice or how you feel or who you are, how you identify, you are accepted here because we want to love you, we want to support you, and we want to help guide you with the right information and tools. And so the only thing that we can do is teach our, sort of our motto, in hopes that that message will resonate with others as well. So thank you.
Thank you so much.